So let us start today. We'll be doing ENT, and the first topic is rhinitis. Can you see the screen? Anybody tell me? It is
Yes, ma'am.
visible. So the topic is rhinitis. Okay. As the term says, rhinitis means inflammation of nasal cavity. So there are two types, allergic rhinitis and non-allergic rhinitis. What is allergic rhinitis? It is also known as hay fever. So the symptoms are mostly sneezing, congestion, itching nose, and watering eyes. It is the allergic reaction to tiny particles in the air, which is known as allergens. So when we breathe these airs containing these allergens through the nose or mouth, body reacts and it releases a natural chemical called histamine. This cascade you all know. So and it causes this rhinitis. Allergic rhinitis, it is not the same as infectious rhinitis. It is also known as common cold. It is not contagious because it is not infectious. It is allergic. So what triggers allergic rhinitis? Basically, it is the hypersensitivity response of upper respiratory tract. So the triggering factors are pollen from trees, weeds, plants, mold, spores, pet danders, the hair of the pet. Some people they keep a cat and dog in the house, inside the house they keep them. So the pet dander, dust mites, cockroaches, droppings and saliva also that can also cause this allergic rhinitis when you breathe the air containing those allergens. So this is seasonal allergies occur in spring, summer and early fall when trees and weeds bloom and pollen counts are very high. That time normally it occurs. What are the symptoms? So basically this is allergic rhinitis inflammation. It causes inflammation of the nasal mucosal layer with exudate in the airway. So that causes all the symptoms. Symptoms will be sneezing, stuffy nose, runny nose, mucus, postnasal drip. Postnasal drip means something trickling down the throat, backside of the throat. Then some patient will say sinus pressure like headache and dark under eye circles. These are the signs and symptoms of allergic rhinitis. Some patient will feel tiredness, sore throat from mucus, sore throat because the mucus is dripping down the throat. So the patient will complain of sore throat also. Wheezing, coughing, breathing trouble can also be there because of this rhinitis. Allergic rhinitis, it occurs when the body's immune system reacts to the irritant in the air. So the irritant, I told you all the factors. Those are the irritants. When the person inhales that air through the nose or mouth, that triggers that cascade, that allergic cascade, and all the symptom appears. These allergens are harmless to most of the people, but Some people, the immune system thinks the allergen is intruding. So the immune system tries to protect the body by releasing natural chemicals in the blood. The main chemical, you all know, it is histamine. It causes mucous membrane to become inflamed. Mucous membrane of nose, throat, and even eyes. It causes to inflame the mucous membrane, and the symptom appears. Allergic rhinitis comes from many allergens. I told you those pollen, pet danders, uh, cockroach, saliva, mold, etc. Food allergies can also cause inflammation. Some people have food allergies also, that can also cause allergic rhinitis, allergic conjunctivitis, all the allergic symptoms of the body. So what are the risk factors? Risk factors: people having asthma or eczema are more likely to develop this hay fever or allergic rhinitis. Now, how it is diagnosed? Diagnosis is by blood test to see the specific allergen. These allergy tests are done to see the specific allergens which is causing, which is triggering the rhinitis. Then nasal endoscopy is done to see the passage of this nasal passage, to look for the inflammation and the structural abnormalities. Nasal smears are taken to check the eosinophil counts in the nasal secretion. So how it is treated? To avoid the allergens, once it is detected, the allergen, once it is detected, avoid that particular allergen. Like if a person is having allergic to any food, or if he is having allergic to pet dander or pollen, so avoid those situations. Then some medications are there. I'll go to the treatment part later on. And the saline nasal irrigation to keep the nasal mucosa moist. That will relieve the symptoms. And these are the prevention: clean the home, keep the home clean from mites, danders, and other allergen. This
Ma'am,
meti pot. Tell me.
ma'am, whenever we do the allergic test, always it show everything high, like dust, food, and like pollen. So, like, ma'am, like how to avoid all those things? Like, not possible. Like every food,
No,
if do.
no, a particular thing. If a particular thing is written, like any food, any source, this dust, it is not so significant. Everybody is having dust. They will be exposed to dust. But other particular things, like any sort of food, prawn, brinjal, egg, anything, particular food or particular object, that is significant.
But in
And
my food also so many
uh,
things. If you saw brinjal, tomato, then prawn,
mhm.
egg, so many things.
Yeah, the person who
Hardly.
is having this, if that is coming positive, you have to avoid that, because you cannot just separate one thing. Suppose a thing is coming that the person is allergic to tomato, brinjal, egg, everything. So first you have to avoid all those things. Then you have to cut one. Which one is actually the person is actually allergic to the thing. Always it is correlated clinically. You will
Oh,
see all the things will come high. Have you seen?
yeah. That is what, ma'am, like in my
Yeah, many thing
patient.
it comes. Many thing it comes. Because we are exposed to so many things in real world, na? So many things. So it comes so many things. So you have to choose, like, if many things are coming and the person is having the attack today. So you think, what I took yesterday, did I take any egg? Did I take prawn? Did I take brinjal? Whatever that the things are written there. If you have not taken prawn for many days and it is coming there, so you discard. You just omit that one, and it has to be related, correlated with the clinical things and your history. What you have taken within last few days, you have to correlate with that.
Ma'am, suppose
Okay.
one day
Hmm.
between those. Like
Hello,
today I
I
eat
cannot hear
prawn.
you. Yes.
Ma'am, like what will be the
Hmm.
gap? Suppose today I took prawn, tomorrow I took brinjal. So like I will be confused whether it is from prawn or today I have eaten brinjal. So it should be 24 hours gap between these two food or
No,
48 hours.
if both the things are in your allergy test, you have to avoid both the things. If
Okay.
there are 20 things in your list, that cannot be na 20 things. If one or two things you are knowing that these two things are causing me allergy. Whenever you are taking again when these two things have come, you are having doubt whether I'm having with brinjal or egg. You are having doubt, no. So next week you omit one and you try with another. Then if you have that again it occurs, then you have to avoid that one. But if it doesn't occur with the brinjal, then you understand that it is with the egg. And
Yes.
it is better if you avoid both the things.
Okay, ma'am.
This is with the clinical thing, na? Because everything will come. We are exposed to so many things, and this mast cell will react with which component of that particular thing that mast cell will react. No,
Yes.
so that is the main thing. So this is the test, huh? Allergy. After allergy test, you will do this endoscopy and see the structures, nasal structures, to see whether any other things are there or not. Deviated septum is there or not. And then this is the treatment. This neti pot is a thing for taking vapor. Have you seen anybody? Have you seen this neti pot? It is a pot with a hose and uh, for taking the steam and keeping the nasal cavity moist so that the inflammation and allergy will be reduced. Inflammation will be reduced. Then the treatment OTC antihistamine nasal drop, the chlorpheniramine, pseudoephedrine. These are the antihistaminic. And allergy shots, these are given by physician. This physicians will be the actual doctors for this allergy part. And ENT doctors will do the nasal part, this nasal and throat part. Now, another term is non-allergic rhinitis. Okay, one is allergy and okay, I forgot to tell you this loratadine, cetirizine, fexofenazine, levocetirizine. These are the antihistaminics you have to give to the patient who is having allergic rhinitis. Decongestants like phenylephrine, pseudoephedrine, nasal spray. In long-standing cases, when these things are not working, then corticosteroid nasal spray is given because it will reduce the signs and symptoms of the allergy and also the inflammation of the nasal cavity. Now, this non-allergic rhinitis. Non-allergic rhinitis is a nasal condition that causes same condition. Condition is same. Symptoms will be same. It will be congestion, running nose, sneezing, but without an allergic trigger. There will not be any allergic trigger. Like it is not related to those food and those pet animal dander and this um, other things, other allergens, which I told you in case of allergic rhinitis, the triggering factor will not be there, but the symptoms are almost same. The congestion, running nose, sneezing, these are all same. But what causes this non-allergic rhinitis? It is because of, can be of from infections, hormonal changes, certain medications, irritants, some drugs, those non-prescription drugs, those cocaine and all they inhale through the nostril, no? So while inhaling through the nostril, that can cause rhinitis. Though in case of non-allergic rhinitis, these are the causes, non-anatomic and anatomic. Adenoid hypertrophy, corneal atresia, polyp, foreign bodies, tumors. They can release some substance that can cause allergic reaction in the nasal cavity. But this is non-allergic means that that is not because of any triggering factor. Non-anatomic is eosinophilia, vasomotor. Another thing is vasomotor rhinitis. It is very common, vasomotor rhinitis, and rhinitis medicamentosa, infectious rhinosinusitis, neonatal rhinitis. Now, what is rhinitis medicamentosa? If you keep on using a nasal drop for too long duration, the nasal mucosa becomes atrophied, and it becomes dependent on that particular medicine, particular nasal spray, and it causes atrophic rhinitis, and it is rhinitis medicamentosa. This is the causes of non-allergic rhinitis. So the tissue inside the nose becomes inflamed, swollen. It is like allergic one only. So the inflammation, this causes unpleasant symptoms most people associate with allergies like a stuffy or runny nose. Unlike allergies, vasomotor rhinitis doesn't result from exposure to allergens. I told you those dander and all. It's not caused by virus or bacteria also. Instead, you may experience symptoms because of some weather changes, then certain smells. Smell of a paint can trigger smell of a paint. Then eating habits, exercise, medications, recreational drugs, non-prescription drugs. They can trigger this nasal mucosa inflammation. Vasomotor rhinitis is also known as idiopathic rhinitis because actual cause is not known. Which particle is causing rhinitis? It is not known. So who is likely to have vasomotor rhinitis? Anyone can develop vasomotor rhinitis, but mostly it is diagnosed after age of 20. Allergic rhinitis, it happens in case of children, but vasomotor rhinitis above 20 years of age. Majority is diagnosed between the ages of 30 to 60 and common in women, unlike allergic rhinitis. It is common in males. So these are the triggering things of vasomotor rhinitis. Nasal decongestant sprays, overused, that can cause rhinitis medicamentosa. I told you there's some blood pressure lowering drugs, then NSAIDs, hormonal medications like OCP, then some medicines which treats ED, erectile dysfunction, then antidepressing drugs, sedatives. These can cause this vasomotor rhinitis or non-allergic rhinitis. Clinical picture is almost same: sneezing, nasal itching, and this is a disease of childhood, and this occurs after the age of 20 in case of adults. Hyposmia and nasal congestion predominantly, otherwise other symptoms are almost similar. Triggered by allergic rhinitis is triggered by seasonal antigen exposure like increased pollen, and this is in case of children. It is in old age, caused by temperature, barometric pressure changes. Now this is in common for both the things. Avoid the triggers. The things which is triggering this one, avoid it. The conditions which is triggering non-allergic, avoid it. And treatment is intranasal corticosteroid and antihistamine. It is common to both the things. Symptoms are almost same, but the environmental triggers, a non-allergic rhinitis is due to environmental triggers like a drop in temperature, air pollution, smog, cold or dry air, any strong perfume, cologne, that can also cause cigarette smoking, paint, smell of paint, spicy food, stress. These can trigger Some medications like nasal decongestants, ACE inhibitors, NSAIDs, birth control pills, OCPs, and this antidepressant sedatives. These all can cause non-allergic rhinitis. So it is mainly seen in menopausal women and pregnant women. Diagnosis, again, allergy testing is done here, an endoscopy of the nasal cavity. So in allergy testing, it will come, nothing will come, it will come negative because there will be no allergic, no triggering, no allergen is there. Nasal endoscopy will tell you whether there is any deformity, whether any polyp, any growth, any other thing. CT scan will show the structural deformity like deviated nasal septum. If it is there, it has to be corrected surgically. The treatment of non-allergic rhinitis is nasal decongestant sprays, antihistamine. Then in long-standing cases, corticosteroid nasal sprays and anticholinergic nasal spray, ipratropium bromide. Surgery is the last option if there is any deviated nasal septum. Prevention, it cannot be prevented. You cannot put any medicine to prevent it, but you can lower the risk by avoiding triggers which causes the rhinitis. So this is all about rhinitis. Now I'll go to another topic. Next topic is nasal polyps.
Ma'am,
Yes.
ma'am, sinus like frontal sinus, sphenoidal sinus, ma'am, which can cause the brain abscess?
Sinusitis. In sinusitis chapter, I will tell you which causes brain abscess.
Ma'am,
Hello, I cannot hear.
yeah, ma'am.
Which causes brain abscess? You said.
Yeah, ma'am. Each sinus which can cause brain
Yeah.
abscess.
Commonest. You mean to say commonest is the frontal is near the brain. Sphenoidal sinus is connecting the brain. Okay, like maxillary. Ethmoidal and maxillary, they can also cause because all the connections are there. But most common is sphenoidal and frontal. They are connected, directly connected to the brain. Meningitis, encephalitis, abscess. The infection if goes directly. So commonest is you have to know the anatomy. I'll tell you in sinus chapter. You have to know the anatomy because it is directly connected. Sphenoidal sinus and frontal. Maxillary is in the cheek and ethmoidal is in the nose. So there are chances, but a bit lesser than other two. Okay.
Ma'am, which part of the brain it is affected?
Meninges, it will spread in the meninges and then frontal side of the brain.
Okay. Meninges and frontal.
And via and encephalitis, meningitis, it can be localized, it can be generalized also. It depends on the spread, where it is spreading. That is complication. If you don't treat the sinus for a long time, then it is a complication. It is not that every person who is having sinusitis will have brain abscess, will have meningitis and all. Okay.
Yes.
So that will tell you in sinus chapter. Now let us start. What are nasal polyps? Have you seen nasal polyp in clinics? Everyone here is graduate, no?
Yes, ma'am.
You have done ENT clinics and all.
Yes.
Have you seen any nasal polyps in the clinics?
Yes, ma'am.
How it looks? What is the appearance? Nasal polyps are growth in the nasal passage. They resemble peeled grapes. It looks like grapes, like a teardrop. See, this is a teardrop. And if it is multiple, small, multiple, then it becomes like grapes. It is a painless and benign growth, non-cancerous. They form in the mucosa. Mucosa means lining of the nasal cavity, sinus passages. They usually appear on both sides of the nose. It can be unilateral, it can be bilateral. Nasal polyps can get irritated and swollen, which makes difficulty in breathing. So the person who is having a polyp will have a breathing problem also. Then it is confused with asthma. The person is having any chest infection. You may think he is having any chest infection, he is having any other problem with the breathing, but the person who is having a big polyp or small multiple polyp can have breathing problem. So you have to start checking from the nose. And then if it is clear, then you think it can be asthma or it can be any other thing. Small polyps are teardrop shaped. So I told you it is like a teardrop or like a grapes together. It affects 40% of the general population and common in males. Age group in between 30 or 40. The risk increases with the age. Nasal polyposis is another name for polyp. Nasal polyposis. So what are the symptoms? Nasal congestion means stuffy nose. The patient will say nose block, cannot breathe, sound noisy breathing. Rhinorrhea means running nose, watering from the nose. Watering from the nose, then headache. It can cause loss of taste and smell. Post nasal drip, nasal bleed. Post nasal drip means the secretion is trickling down the throat, back side of the throat. Nose bleeding, epistaxis, sinus pressure, snoring. Snoring can also happen. This is also a symptom of nasal polyp. When the polyps grow large enough and block the nasal passage and sinus, it can lead to frequent asthma attack, repeated sinus infection, sleep apnea disorder, because the person will not be able to take proper breathing. Okay. So this inflammation of the nasal cavity, it causes nasal polyp. This is the picture. These are the symptoms. Nasal polyp symptoms in allergies versus asthma. So in allergy, this is if it is due to allergy, if the symptoms is due to allergic reaction from the nasal polyp, so these will be the symptoms. And in case of asthma, shortness of breath, wheezing. These symptoms can be seen here also in polyps, but other things will be also there, like nasal discharge, loss of sense of smell and taste, headache, facial pain due to sinus pressure. Signs of nasal polyps in children. Mainly, the child will complain of blocked nose, noisy breathing, running nose, sneezing. There can be epistaxis, then snoring, thick fluid buildup in the nose, headaches, and this is post-nasal drip, reduced sense of smell and taste. How nasal polyp affect the body? So this already I have told you. These are the, just look at the picture so you will not forget. Seeing the pictures, na, you will not forget. Otherwise, if I speak only, you may forget the things. see the pictures, it will remain imprinted in your brain. Chronic sinusitis can also cause nasal polyposis. Chronic sinusitis refers to nasal and sinus inflammation. They can also cause the swelling in the nasal mucosa, and that is the nasal polyposis. Risk factor: allergic rhinitis is a risk factor. Chronic sinusitis, asthma, cystic fibrosis, NSAID, these drugs also can cause. Anybody can tell me about cystic fibrosis because it is a topic of medicine. Anybody from medicine? Cystic fibrosis. What happens in cystic fibrosis? This is a risk factor. I told you this is a risk factor for nasal polyposis. So what happens in cystic fibrosis? Can anybody tell me?
Ma'am, mucus plugging, ma'am, it affects the respiratory intestine. Like, ma'am.
So it is blocked. The secretions are blocked and
Yeah.
accumulated, right?
Yeah, ma'am. Thick mucus we will see over there.
Yeah,
The
it is
cilia
not
become
drained. Sorry?
Ma'am,
the cilia become what do you call, the ciliary function is decreased. That's why mucus get blocked.
Yeah, yeah. Cilia is not helping to move the secretion. Am I correct?
Yes,
Yeah.
ma'am.
Ma'am,
Yeah, the
CFTR, we will
secretions.
see mutation of the
Uh,
CFTR.
yeah. So the ciliary function is to move the secretion. Move the secretion. मतलब आगे जाओ, आगे जाओ. It will not go आगे जाओ. It will stuck there, and
Yeah.
it will cause the accumulation. So that is cystic fibrosis is a big thing. So you people learn in medicine chapter. Just remember it can cause polyp because the things are collected. It is not moving. Cilia is not functioning. It is not moving, collecting, and the collected is becoming a polyp. Okay, so that is a genetic mutation, I think, this cystic fibrosis. Now, the complication of nasal polyposis, there are serious complications also. Abscess formation. If it is not treated, abscess formation, osteomyelitis, meningitis, like bones surrounding the nose, nasal bone can get infected. That will cause osteomyelitis of the nasal bone. Then abscess formation. Meningitis, because nose again is connected to sinus again is connected to brain and meninges. So if it is not treated and it is left like that, so it will reach brain, meninges, from nose to sinus, then meninges, brain. Anything can happen in brain after that. After meningitis, anything can happen. There are so many things like abscess, what you said. Dr. Nasreen, you were saying, na, abscess.
Yes, ma'am.
So anything can happen. It can be meningitis, it can be myelitis, it can be abscess, can be encephalitis. So serious complications can be there after this nasal polyp if you don't treat it properly, proper time. So how it is diagnosed? Physical examination is the main thing here. Physical examination, like history and all. After history and all, taking history, then physical examination. Look inside the nose with a speculum. With naked eye, then speculum, then endoscope. Look inside the nose properly, whether the nasal cavity is clear with all the things or not. It is inflamed or not. Nasal mucosa is inflamed or not. Is there any growth or not? Deviated septum or not? Everything is clear. So you can think that the symptoms is from something else. Then you do CT scan to see the symptoms is from the nasal deformity, nasal structure or sinus structure. So CT scan will tell you the information. CT scan, then MRI of the growth. Whether there is a growth or not, and if there is a growth, it is polyp or non-cancerous growth or cancerous growth. Anything can be there. So it can be done. Then histopathological examination of the growth lastly. And of course, allergy testing is done to identify the allergens that is leading the inflammation. Now, how it is managed? What is the treatment? So the symptoms I have told already. Yeah, these all symptoms I have covered. Allergy and asthma, allergy versus asthma. These are the symptoms of asthma. The person who is not breathing properly, he can have this polyp, he can have asthma. So how will you differentiate? Person having asthma will have these things: shortness of breath, wheezing, chest pain, tightening, cough, trouble sleeping, this. And in case of polyp, apart from this plus this plus this, these things will be also there along with this. So you have to differentiate. If the nose is clear, nothing is seen in the nose, and these symptoms are not there, then it is asthma. Then you will not refer to ENT, you will refer to medicine. Okay, so you have to differentiate. See, these are the polyps, multiple polyps. This is a clear, this side is clear, nose is clear, sinus is clear. There is no polyp in the sinus, there is no polyp in the nasal cavity. Here, some grape-like things are seen. It is a physical examination. So this is polyps. And this is endoscopic view. This is seen through endoscope, nasal endoscope. This is a fleshy mass, nasal polyp. So histopathology test has to be done whether uh, uh, it is cancerous or anything else, because without seeing the histopathology you cannot comment whether it is polyp or by seeing it you can detect it is polyp, but to be on the safer side, malignancy has to be ruled out. Every time you see a growth, whenever a growth is seen, malignancy has to be ruled out. This again, polyp, nasal polyp.
Ma'am, which cancer we can see over here? Which malignant?
Which malignant? Malignancy of the that growth can be malignant, and then histopathology will see what type of malignancy is there. That histopathologist will see. That
Ma'am,
ENT doctor will not comment. ENT will not. ENT will just send the uh, thing to the histopathology. The pathologist will say whether it is a malignancy or it is a benign. If it is a malignancy, then cancer therapy will start. But this looks like polyp. Now, when you see through endoscope, it looks like a polyp. To exclude the malignancy, this is mandatory to do. Nowadays, everything has to be documented. By any chance, 1% chance, if it looks like polyp, but if it comes out to be malignant and you are not treated with anti-cancer drugs, then that there is another problem, no, for that. The pathologist will tell it is malignant or non-malignant. If it is non-malignant, you are knowing it is nasal polyp. You have already diagnosed it as a nasal polyp, and then for
is the
confirmation you are sending.
which is the
Confirmation you are
commonest?
sending.
No, ma'am. Which is the commonest carcinoma we see in the nose?
Commonest carcinoma. Carcinoma I'll tell you in the carcinoma chapter. Okay,
Okay.
I'll tell you later on. So this is where I was telling treatment. No, yeah, this is the nasal polyp. And since this is a glandular thing, so adenocarcinoma, you are asking about a carcinoma. No? Adenocarcinoma can be there, but doesn't look like adenocarcinoma. It doesn't look like adenocarcinoma. The diagnosis you have confirmed, and just for being on the safe side, you send to the pathologist. So that pathologist will tell you whether it is adenocarcinoma or not. If no, then it's okay. Nasal polyp, you remove it. Commonest, commonest is adenocarcinoma, but details I will tell you in the cancer chapter. Okay.
Okay.
Remember this adenocarcinoma.
Okay.
So these are
Ma'am,
the small polyps. Now the treatment, and we shift to another topic. Do we have time for another topic? Yeah, 15 minutes we have. I'll cover another topic. Ask question. Who is asking? Ask quickly.
ma'am, I was asking that after speculum examination, we should choose endoscopy first or CT scan first.
Endoscopy.
Okay.
First physical examination, speculum examination, then endoscopy, then CT scan.
Okay.
Okay. After that, management part, you all know, medication. If with the spray, it shrinks. Sometimes with steroid spray, it shrinks. So if it shrinks, then very good. If it doesn't shrink, then you try with oral steroids, low dose prednisolone. Oral steroid, if it shrinks, good. Otherwise, you go for surgical removal. So polypectomy is surgical treatment. If you see any sign of infection, then obviously antibiotics to be added. And polypectomy done. Functional endoscopic sinus surgery. Have you heard this term? FESS, FESS, functional endoscopic sinus surgery in ENT. Have you heard or have you seen?
Yes, ma'am. Heard.
So it is a surgery. So endoscopically it is removed. So we finish this topic. Next topic I am touching now. Wait. Next topic is our epistaxis. Screen is visible?
Yes, ma'am.
Okay. So epistaxis, you know, bleeding from the nose. During childhood, some of you must have experienced also. It is common in children. It's the nosebleed. Nosebleed, medically it's called epistaxis. Loss of blood from the nasal bleeding from the nostrils. It can be from one nose. It can be bilateral also. So from where it comes? This is a Kisselbeck triangle. The arteries, the anterior part of the nose is the commonest site. Damaged vessel causes bleeding in the nose. Types, there are two types, anterior epistaxis and posterior epistaxis. So anterior epistaxis from the anterior, see this is the vessel. Anterior epistaxis is from the bleeding from the Kisselbeck's plexus, and all these arteries come and unite here. This is Kisselbeck's plexus. Posterior bleeding is from this anterior ethmoidal artery. It can be posterior ethmoidal artery, sphenopalatine artery. If bleeding from this part, it goes down the throat, and this is dangerous type of bleeding because you cannot control very easily. You cannot reach out here. Here you can reach out. How to manage this? I will tell you. So first, these are the two types of epistaxis. One is anterior, another is posterior. Symptoms, it is bleeding. If it is swallowed, then the patient will have vomiting tendency also. That is included in the symptoms. Causes of nosebleed. Epistaxis, dry air can cause, allergies can cause, blood thinning medications, recreational drugs, cocaine and all, high altitude, deviated nasal septum. And one very important thing they have not mentioned, it is nose pricking. Children, they often do nose pricking with a finger. That also causes bleeding. Then sometimes tumor, polyps, they can cause bleed. These are the causes of epistaxis. How to treat? Make the child sit down, lean forward. Tell the child to lean forward. Common in case of children, and they should lean forward. Why? Because if they lean backward, the blood can trickle down the throat. It is dangerous. The blood should not go backward. It should come. It should come out from the nose. Some mother, what they do, they think that bleeding is there, bleeding is coming from the nose, so they tilt the head backward to stop the bleeding. Because when you tilt the head backward, when the child is leaning backward, automatically the blood will not come from the nostril. The blood will go back in the throat. The mother who is doing this, she is not understanding that she is stopping the bleeding from the anterior aspect, and it is going posterior. That will be going to the passage, airway passage. She is not understanding, so she is telling the child to backward lean. So backward lean is no, because it should come from the anterior. It should trickle down anteriorly. Even if it is trickling down from the anterior, you can control it. You got my point. Why the mother is doing backward? Because she is thinking the bleeding should stop. And definitely bleeding stops. She is not seeing the blood in the anterior nostril. The blood is going backward. So it is important to make the child sit properly and lean slightly forward so that whatever blood is there, it should come out. It should not go backward. And then squeeze soft part of the nose with thumb and forefinger for 10 minutes and then repeat. Then ice pack or any cold cloth to be put on the bleeding part. This way. You have to pinch the nose. But never lean backward. So this is the area you have to pinch. Not on the hard part. Yeah. This is a bony part. Bone ends here. Everybody touch your nose and feel. Everybody touch your nose and feel that bone ends. Where the bone ends. Here the bone ends and here the soft tissue comes. Touch your nose, everybody, and tell me what is the difference. What is the difference here? Anybody tell me? Dr. Lalit, you are speaking something?
Yes, ma'am. Where the bone ends, the cartilage starts, so it becomes soft.
Yeah. You have touched your nose and telling no?
Yes, ma'am.
Yeah. You have to see practically. You have to do it practically. Ratta hua cheez nahi. So here the bone ends and cartilage and then the soft part comes. So press here. Do not press here. Press here. So when it is pressed here, the bleeding automatically stops. Then cold compress has to be given. This is a wrong procedure because you're blowing the nose. It will increase the bleeding. Blowing the nose is avoided. Just pinch the nose. Use saline spray or lubricants to keep inside of the nose moist. Moisture will reduce the bleeding. Then other preventive measures are avoid smoking. Don't pick your nose. The children who are doing the nose picking habit, they should avoid it. Steam inhalation also moistens, protect the nasal cavity, and it reduces the irritation. Avoid those blood thinning medications like aspirin, NSAID, warfarin. These can cause bleeding. Drugs and alcohol, obviously, it has to be avoided. And you have to ask the patient the history of hemophilia, von Willebrand diseases, and other blood-related diseases. High BP is the commonest cause in elderly person. Atherosclerosis and hypertension is the commonest cause for nasal bleed. Then any surgery, past history of facial or nasal surgery. Tumor, polyp, thrombocytopenia, leukemia, these can cause epistaxis. Sometimes pregnancy also causes because of the hormonal imbalance. Sometimes pregnancy also causes epistaxis. So risk factors, it is commonly in between the ages of 2 to 10 and above 45. In that case, the person will be having high BP, atherosclerosis, bleeding disorders, other things. In pregnancy also it is seen. People taking warfarin, this is also a risk factor. So you have to stop those things. Now, the diagnosis, obviously, for physical examination, speculum examination, and testing the anemia. If constantly he's bleeding very small amount from the posterior arteries and it is going inside, So anemia will be there because very little amount every day it is going and patient is not knowing anything. So it will cause anemia also. So these are the main causes. So what is the treatment? Nasal packing, then cauterization, and if after that it is not controlled, tranexamic acid tablet. If there is any foreign body, remove the foreign body. If there is any polyp or any tumor, treat that. Now nasal packing, anterior nasal packing, anybody can do from the anterior aspect of the nose. Anterior nasal packing, any GP can do. Put the gauze on the nasal cavity and give pressure on that. And posterior nasal packing has to be done by ENT specialist. Refer the patient to ENT specialist for posterior nasal packing. Then foreign body removal. If there is any foreign body, again ENT specialist will remove. Lastly, surgical treatment is septoplasty or ligation of the blood vessel. Septoplasty in case of deviated nasal septum. Septoplasty is done. So this is the surgical treatment of epistaxis. Meanwhile, you have to tell the patient to sit straight, lean forward. Do not lie down. It is very dangerous. Keep calm and then breathe from the mouth
Ma'am,
till the doctor
can we
till the
stop?
doctor arrives. Huh?
Can we
Till
pinching
the doctor arrives. Tell me.
pinching of the nose can stop the posterior side of the bleeding?
No, no, no. Posterior cannot be because anterior you are stopping, na? You are giving pressure to the anterior vessels. So posterior, it is alarming. You have to send the patient immediately to the ENT specialist because posterior packing is also difficult. A GP cannot do posterior packing. A GP cannot control it. A GP can give tranexamic acid tablet to stop bleeding. Okay. Then nasal spray, saline spray, these
Ma'am, how
and
we will understand it is a posterior? If it doesn't stop, then we should go for an emergency.
yeah. Because if the blood is coming from the nostril, that is epistaxis. So you will examine with the speculum and you will see anterior cavity is okay. You will take a gauze and then you will examine the nasal cavity na, from where the blood is coming. When you are taking a gauze and examining with the speculum, you are seeing anterior cavity is okay. Nothing is there. That means blood is coming from posterior. Immediately, the patient should be rushed to the emergency.
Okay.
But the pinching you will continue. Pinching you will continue. Maybe it can stop. But if it is not stopping with the pinching, that means from posterior it is coming. And you are giving cold compress also, you are putting gauze also, then also it is not stopping, it's coming, then it's from the posterior.
Posterior.
Okay. Damp cloth, ice pack, those have to be given. Meanwhile, you take the patient to the emergency, you do all those things and then move. Then other things doctor will do.
Ma'am, one more question. Ma'am, in the old age, we see due to hypertension, there's patient have a bleeding. तो पेशेंट आकर कंप्लेन कर देती ब्लीड हो गया तो अच्छा नहीं तो ब्रेन हेमरेज हो जाता एंड डॉक्टर ऑल्सो से इट्स गुड लाइक ब्लीड हो गया सो मैम व्हाट इज दिस इट्स गुड ब्लीड हो
If
गया
the cause is if the cause is hypertension, if there is no nasal pathology, if the cause is hypertension, so you have to treat the hypertension because that hypertension is causing bleeding. And who will say bleeding is good? Epistaxis is good. Hypertension is good. Who will say hypertension is good? No, hypertension is never good. Now who says the patient ne bleed kiya acha ho gaya? Doctor said. What? I just want to clear it.
पेशेंट
Any doctor said?
पेशेंट से डॉक्टर बोलता है कि
Patient.
ब्लीड अच्छा
No, 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 no. Hypertension is never good. Bleeding is never good. When the doctor will say bleeding is good, I'll tell you. Suppose collected blood is in the nose, collected blood is in the uterus. In the uterus, there is a term when the blood is collected. I forgot the term. That hidden blood in the uterus, menstrual blood is collected. I forgot. Anybody remember that term?
Ma'am, which term?
Normal menstruation नहीं हो रहा है and the blood is collected in the uterus in young
Ma'am, dog of watch.
something is there. So that
Watch
time
of
if
dog.
the pouch of Douglas. So
Yes,
that
ma'am. Watch
bleeding
of
is
dog.
that bleeding is yes, that bleeding is good. Some blood is collected there, menstrual blood is collected there. It is not coming out and it is drained accidentally or by any therapy or by any tablet, anything. That bleeding is good. If it is blood is collected in the nasal cavity and it is stuffing the nose and it is coming out, that is good. But continuous from the vessel, it is coming, it is never good. You got my point. When bleeding is good, when
Yes.
when bleeding is good, you are removing the blood. In eye also, I tell you, vitreous hemorrhage is a term. Vitreous hemorrhage. So you remove the blood. So that bleed, that removal is good. But otherwise, blood removing from the artery, running artery, that is never good. Hypertension is not good. Similarly, bleeding is not good. So maybe patient doesn't understand what doctor is saying.
Okay. Ma'am, one more thing, ma'am, in hypertension, bleeding, which artery causes this? In hypertension, which artery affected? Which caused the bleeding?
Hypertension in general hypertension, whole body artery is affected. In ocular hypertension, central retinal artery is affected. So there are hypertension of various arteries. So in eye, in ophthalmology, if only that part is affected, that is called ocular hypertension, and that is central retinal artery. But if whole body vessels are affected, anywhere the person can start bleeding. And not necessarily all hypertensive patients are bleeding. It is not necessary.
Not
Fragile. What is the mechanism? See, the vessels become fragile. The vessels become fragile and it is moving in a high pressure. You just imagine a pipe is there. Water is flowing from the basin tap in a very high speed, very forcefully. You have opened it very forcefully and the pipe is a weak pipe. Uska vessel थोड़ा पतला हो गया है. So that forceful, what the forceful water will do? The pipe will burst. Got my point? That is the mechanism. The water is flowing in a high pressure, and the vessel is fragile. The pipe is thin, it will burst. This is the mechanism. So where it will burst, you never know. You from the top floor to bottom floor in your building, the pipe, where it is fragile, you do not know. It can burst in first floor, it can burst in third floor, it can burst in fourth floor, anywhere it can burst, wherever the pipe is thin. That means wherever the vessel is fragile, there that place it will burst. Not that कि whole body में burst हो गया वो तो मर ही जाएगा. Got my point? Now clear, Dr. Nasreen?
Yes, ma'am. Yes, ma'am. It is clear.
Okay, fast we'll do the questions because time is over. Wait. When you see the screen, just tell me.
Yes, ma'am. We can see.
Okay, this is the first question. 56-year-old present with vasomotor rhinitis. What is most appropriate treatment? जल्दी बोलो, टाइम नहीं है. See, vasomotor rhinitis है या allergic rhinitis है, anything, allergic or non-allergic. First, we will give antihistaminic. If it is not acting, then decongestant, or we can give both together. Steroid and all, it comes later on. अगर काम नहीं हो रहा है, if it is not working, then steroid comes. Okay, so local antihistaminic. And systemic antibiotic, it is not needed because it is not infection. So systemic antibiotic is not needed. Patient with seasonal nasal discharge, watery, what is the first treatment?
Antihistamine.
Yes. Initially, always antihistaminic. Okay. Then you give decongestant, and further, if not treated, then steroid. But antibiotic is not needed. Patient had seasonal runny nose, itching, nasal obstruction, treated many times with broad spectrum antibiotics. The most effective therapy is, just now I told you the answer. Many times treated again and again, and these things not relieved. Then what will you give? Will you start with antihistaminic and decongestant? Because many times treated. Now tell me.
No, steroid.
Yes, because many times treated, na? Many times treated means he is already getting this. Many times treated means he is getting this. So still it is not relieved.
Yes, ma'am.
Many times treated with broad spectrum antibiotic. Means this given antibiotic also tried. Antibiotic actually not needed, but it is given. Still it is there. Means if it is long standing disease, long standing, उसमें topical corticosteroids. Next question is, 5 years old seen in ER presented with fever and sore throat. Which of the following suggests viral etiology? Viral. What will you see in viral rhinitis? Viral. See, the color will be, the discharge of the nasal discharge will be colorless. Bacterial, it gives color. You will get curdy white or something yellowish color will be there. Rhinorrhea will be colorless here. Young man with nasal bleeding from posterior septum, not known to have any medical disease or bleeding disorder. What is the management? Just now I told you. Posterior epistaxis.
Ma'am, A, tampon in posterior septum.
Yes. These will come later. Okay. Injection and all. First try packing tampon in posterior septum. You have to refer to ENT doctor. Posterior packing, don't try. So this is the answer. Anterior, you can try with nasal pinching and anterior packing. But posterior, refer to ENT specialist. Doctor will do the packing. First step in management of epistaxis. First step. First step. These all are later on you will do. What is the first step?
Pinching.
Yes, the first step. Young patient with congested nose, sinus pressure, tenderness, and green nasal discharge. Previously it was colorless. Okay, previously it was colorless. Now it is green nasal discharge. Has been treated 3 times with broad spectrum antibiotic. Previously, what is your vaccine? Again, same. See, it has been treated 3 times. So many times.
Corticosteroid.
Nasal
Yes,
corticosteroid.
yes, corticosteroid. So answer is corticosteroid. What is the best diagnostic test for maxillary sinusitis?
X-ray.
Best
CT.
for sinusitis. What is best? X-ray is not best.
CT.
What is best? Yes. For sinusitis, it is CT scan. not X-ray. Best is CT scan. Okay.
Ma'am, why not MRI?
Because bony structure has to be seen.
Okay.
Bony structures. So we have covered this nose. And this is sinus. Leave it. Nose part we have covered. Next day, I'll be taking your ophtha class this month. Time is over. Okay.
Ma'am, optho which topic?
Ophthalmology. I will take eyelid.
Eyelid.
You have done conjunctivitis. Conjunctivitis is done with you.
No, ma'am, conjunctivitis is not done yet.
What part I have completed? You just tell me the part completed, then I'll tell you. I have done this
Ma'am,
hypertensive retinopathy.
Yeah, ma'am, we have attended
Yeah,
hypertensive retinopathy and
Retina,
diabetic.
retina.
Yeah.
That means retina is done. Hypertensive retinopathy, diabetic retinopathy, retinal detachment.
Yeah, yes.
So
ma'am.
it is done. So conjunctiva cornea, it is not done.
Yeah.
Conjunctiva, cornea, cataract, uvea, those things are not done, right?
Yes, ma'am. These things I have not done.
Okay. Others also tell me. Everybody agree with these topics? Conjunctiva, cornea, cataract, dacreo, uvea.
Yes, ma'am. This is my first lecture of ENT.
This is okay. This is not done, so I'll cover that because retina part almost done. Okay. So conjunctiva, cornea, cataract, uvea, 2-3 topics I'll take. So today we wind up. Okay. Take care.
Yes, ma'am. Thank you. Bye bye.
Thank you, ma'am.
Bye.